420. And we are going to be talking, you know what? This is the day that some have been waiting for. We're going to be talking with Dr. Allison Rodgers from the Fertility Centers of Illinois about the impact of marijuana, also known as ganja or weed. And I know there are a lot of other names, THC, and other products on fertility and fertility treatment. So thank you, Dr. Rodgers, for being here.
Thank you so much for having me.
Awesome. So first, tell me a little bit about how you came to be somewhat of an expert in this topic. Was it that you had patients who wanted to know, can I continue to smoke weed while I'm trying to get fertility treatment? Or
Yeah, so in Illinois, like many other states in the country, marijuana is now legal, both for medicinal reasons and recreational. And there are, a lot of patients and their partners who use marijuana both before and after it was legal. And it's, we as fertility doctors educate our patients on all kinds of things that will help them conceive, whether it's, diet, exercising, medications that they're taking that for something that may be interfering, and other lifestyle choices that it's important for fertility doctors and all doctors really to educate their patients about what's going to help them achieve their goals and what might be in their way.
Okay, that's great. So again, for those of you who are just joining in on Facebook and Instagram, we've got Dr. Allison Rodgers from the Fertility Centers of Illinois. And our topic today is fact versus fiction, CBD, THC, and good old-fashioned marijuana and your fertility. So thank you so much, Dr. Rodgers. She shared a little bit about why she cares about this topic, because it's important to her patients. And just like in many other states, in Illinois, marijuana is legal to use both recreationally and medicinally. So can you talk a little bit about the difference between people who, or the difference between marijuana, just smoking the plant, versus taking CBD, which is, I think, one of the byproducts of breaking down the plant, or even THC. Can you talk a little bit about that?
Yeah, so this is a really common thing where a lot of times people are using these terms interchangeably, but they're really not. So marijuana is the plant, as you said. A lot of times it's smoked or put into edible options, and the sort of chemical that causes the high that people enjoy is THC. And THC is what really is the chemical component to the marijuana. And the THC can be used in gummies and other edible forms, and it doesn't always need to be smoked. CBD is a chemical component of the marijuana that causes a lot of medicinal properties. And I think this is a topic where a lot of research has not been done yet, but it does not cause the high. And so this is a supplement that can be used, not regulated by the FDA because it's a supplement, and it does not cause the high. So when you think about CBD oil and CBD whatever lotion, and that is to help with sort of pain management and some other things that people think it may help with, nausea, other things, but it will not cause the high that THC and marijuana. So that's the difference. CBD does not cause intoxication.
And so are there differences in the way the body reacts to CBD versus THC versus just smoking the plant? And are any of those either in isolation or, multiple, are they good for you? Are they helpful for fertility, or are they harmful for fertility? Or
so I think, yeah, so I'll speak first to the CBD. First of all, CBD in general can be helpful for patients who have joint pain, nausea, that kind of thing. From a fertility perspective, there's really no effective studies showing that the CBD is something that can benefit fertility. When we think about marijuana and smoking, I will just say smoking anything at all, inhaling smoke into your lungs will cause cancer at some point because of the carcinogens that are burning. So I don't recommend anyone ever smoke anything. So, THC, which is the chemical component that causes the high, it can be found in edible forms. Now, when you smoke something, it gets to your lungs, and there's a lot of blood vessels in our lungs. And so people can feel that high very quickly, just like, smoking anything or inhaling anything. It gets to your bloodstream very, very quickly. When we think about the edible forms, like a gummy, for example, you're consuming it. It then has to get broken down by your stomach and digested. And instead of a few seconds to a few minutes of being able to feel it, we are not able to feel it for a few hours sometimes. And this is important to know because sometimes people actually overdose because they take a gummy, they wait 30 minutes, they don't feel anything, they take another one, they wait 30 minutes. It can often take about 2 hours to feel the effects of it. And so it's just important to know that. From a fertility perspective, it's a little bit controversial in men about marijuana and fertility.
Okay.
So there was original studies showing that marijuana binded to estrogen receptors and that it actually reduced sperm counts in men. There was a study in mice showing that mice, who obviously are very fertile, had a 30% decrease in sperm after being exposed to high levels of marijuana, and that the function of the sperm, so morphology and the ability of the sperm to be able to get into the egg, was significantly reduced. Some more recent studies in humans have shown that sort of moderate use maybe does not cause the effects that we've seen. I will tell you from a personal perspective, I have had patients who say they smoke like an absurd amount, high amount, and they seem to have normal sperm. And I also have patients who smoke very rarely, once a week, whatever it is. I guess that's not real rarely, but very minimal amount and have very hugely affected sperm. So I think that it's really controversial about the role of marijuana in sperm. And I think that, more studies are going to be really needed to know whether it's something that causes problems or not, and it very well be that in one person it may cause a problem and another doesn't seem to. So I certainly don't recommend marijuana for either men or women while they're trying to get pregnant. From the THC and marijuana perspective, once you are pregnant,
Yes.
um, the American College of OBGYN did put out a bulletin recently showing that marijuana can and THC products affect fetal brain development.
Ah,
And it also creates smaller babies, similar to smoking cigarettes. Okay. And, you know, when I was delivering babies, I don't do that anymore. I just get people pregnant these days. But when I was delivering babies, I had a lot of patients who were smokers. And when we would deliver the placentas of these babies, of people who smoke cigarettes, the placentas were all scarred. The vasculature looked very, very abnormal. And, you know, we don't know. And I don't think there's been any studies about marijuana, smoking marijuana at high amounts, and placentas, uh, how they look under the microscope. But I will tell you, it affects fetal brain development,
mhm.
and it also creates smaller babies. Obviously, every woman who's pregnant, and I would imagine most of the women who are watching this are trying to become pregnant and struggling to get pregnant, right?
Yeah.
We want to do absolutely everything to have the safest, healthiest baby possible. And because of that, obviously, I would recommend that while trying to get pregnant, while pregnant, not having any use of, marijuana, THC, or CBD once pregnant for sure. And, I struggle with patients sometimes who are prescribed medicinal marijuana from other doctors for medicinal reasons, pain control, and that can be really a struggle because, for example, I have a patient whose husband was in a car accident and he's on THC instead of opioids, right? So trying to figure that out, I think sometimes it needs to be an individual doctor patient collaboration with all the doctors involved. But for the most part, I think that staying away from any chemicals that can affect, pregnancy or fertility is always a good thing.
So, wow, that was a lot of really good information, and that's important. So for everybody who is out here celebrating 420, it seems like what Dr. Rodgers is saying is put it down, put it all down while you
Well,
are.
so the other hard part and the interesting thing is that when women are sort of developing their eggs, obviously we're born with all the eggs we're ever going to have. And as we go through life, we, lose our eggs, right? So, there is a little bit of a life cycle of about 3 months where eggs are sort of growing from the time they sort of start getting more mature to the time they ovulate. And that's an important time for 3 months sort of to have, as little toxins in our body as possible. For men, it's around 10 weeks. It takes sperm 70 days to be produced. Now, men, they just keep making sperm and making sperm. But anything a man does for 10 weeks can affect, sperm function and everything that we, see in terms of the count, the quality.
So 10 weeks. Anything you do today will impact you and your potential embryo in June. That's pretty hard for many people to kind of, that's a concept that I don't think many people think about.
Right. And the other thing I would say is that I think, especially while a lot of us are here sort of sheltering in place and quarantine to our homes, I think a lot of and maybe not able to do the fertility treatment they were hoping to do, a lot of my patients certainly have reported they've turned more to marijuana and alcohol and other sort of toxins that, I would encourage anybody trying for a baby to really utilize this time to see what you can do to improve your health and not be in this sort of like, woe is me, I can't do it, I'm just going to do whatever the heck I want.
Right.
And to really focus on what their goals are so that the minute they're able to do treatment again, that their body is as ready as possible to be the best success as possible.
So that's interesting that you say you've got patients that have kind of started to drink more and smoke more. What I've heard from a lot of people is because of the limits on leaving the house, whether it's they couldn't, catch up with the person who they usually got marijuana from, or I know that the liquor stores are doing great brisk business right now, but some of them don't deliver, and everybody's not comfortable being out on the roads right now, but I live in Maryland, which is a state where it's not legal to, okay, Reverend Joan Wharton said, amen, put it down. Thank you. So, I live in a state where it's not legal to smoke marijuana, but we do have many clinics that have been set up specifically to provide people with THC or CBD or just the other products. Now, there are many who are part of that community who believe in the medical benefits of CBD because you don't get the buzz, but I have anecdotally heard stories from people who said, this helped a lot with this condition where there was inflammation, or it helped with this condition where there was a chemical imbalance. And you have not found that to be true, or you found it to be kind of inconsistent.
So I will say, if you go right now and Google CBD and fertility,
yeah,
there are certainly people selling CBD who are touting that it will help your fertility. That maybe marijuana won't, but CBD will.
Yeah.
And I will tell you, I went because I Googled it myself and was looking when I was preparing, to know more about this topic. And I will tell you, if you actually go to the scientific literature, which is where we get our science and we practice evidence-based medicine, there has not been any studies in humans or animals with CBD improving fertility. Now, might it help with joint pain? Might it help with potential, it doesn't cause the high, so it's not going to cause, CBD is not going to cause that relaxation and other things. Might it help with anxiety?